So it's an absolute pleasure to have John Githongo as my guest. John is a journalist. He is a former correspondent for The Economist. John has put his life on the line. He investigated bribery and fraud in his home country of Kenya, and later was an official in the government or took a position, and then left because he was investigating fraud and fled literally to the United Kingdom. John also founded the Kenyan branch of Transparency International, and he now is the editor of The Elephant. Great to be with you again, John.
Hi, Tim. I don't know whether it's good evening. It should be good evening in Australia.
It's the evening here, that's right.
I trust you're keeping well. Thank you for your very gracious introduction.
And you and I were colleagues briefly in World Vision, so it's
absolutely we were indeed when you were head of World Vision Australia, and I was in advocacy.
That's right.
It's a great pleasure to link up again in this way. Wonderful.
Well, I'm speaking to you from your home in Nairobi. Maybe if we could just begin, what are you seeing in terms of the virus in Kenya? How is it impacting you, John?
I mean, I think the most dramatic impact of the COVID-19 pandemic for me has been, of course, the measures that the government has implemented to mitigate it. So we have a dusk to dawn curfew. So the nights are eerily quiet. We have a social distancing, physical distancing regime that was embarked upon almost a month ago and was extended again this past weekend for another 21 days. So people are encouraged people are working from home, all schools are closed, all large congregational places have been shut down, schools, churches, concerts, pubs, hotels, etc. We obviously, working from home, using Zoom like we're doing now has become the norm. It's what we spend our days doing actually, and ironically, it's quite efficient. It's quite efficient. It's always better to be able to see someone, to meet somebody in the flesh, shake hands, and all that. But we're coming to terms with the fact that that may be gone for now, and we're going to have to live a very different kind of life. In terms of deaths in Kenya, I think we're over 300 COVID-related deaths, but our testing regime is not that thorough. So even though the government responded actually a lot quicker than even Western governments to implement the mitigation measures, partly because we had a bit of the infrastructure from Ebola still in. So when I arrived in Nairobi, I had been traveling and I arrived on the 13th of March. My temperature was checked. When I told them where I had been, my address was taken, my mobile number was taken. So there's that level of preparedness. But, given the limited resources, what the government has done is shut down, a large part of the economy. We know that the number of deaths that are being announced are probably an understatement of the actual total number of deaths, because we're not doing much screening, testing, and following up. It's
a paradox, isn't it, that coronavirus has hit the wealthy G20 nations the worst, from Italy to France to London to the US. And I guess international travel, international cities may explain that. But we're all expecting that African countries and those with the most fragile health systems will be hit with the same level of devastation. It hasn't happened yet, but is that how you see the projections, or do you think you can actually nip it in the bud?
the measures that have been implemented across a whole range of sub-Saharan African countries, because we know the fragility of our health systems, have been fairly draconian, fairly ruthless in terms of shutting down, and they're enforced by the police, and you get arrested. You're arrested in Nairobi if you're not wearing a mask.
Wow.
Now, and if you're arrested if you're out during the curfew. You go into supermarkets, there are sanitizers everywhere. There's social distancing, physical distancing. So those measures have been implemented. Our expectation, however, with regard to the mortality rate, was that given when we first started seeing cases here at the beginning of March, we expected that matters would peak this last part of April, beginning of May. The figures that the government is giving out on a daily basis do not as yet seem to indicate that we are on that spike yet. But as I said, given the lack of testing, we cannot be completely sure. So there are other signals that we are watching for, which is, like as we've seen in I think in Ecuador, where the real big sign that COVID-19 is sweeping through the community has been the morgues are full. People are even being forced to leave bodies on the side of the road to be picked up by trucks and buried mass graves. So we're definitely not there yet. There are quiet inquiry. People are inquiring into whether we've seen a spike in respiratory deaths caused of pneumonia, TB, etc. Because the people with existing conditions here, in the West, they talk of high blood pressure, diabetes, etc. The disease of old age, but here in our generally quite young population, overwhelmingly actually quite young population, the big concern is that a year or so ago we're dealing with a cholera outbreak. We have a percentage of the population that is living with HIV/AIDS, and many are on ARVs, and so it's the intersection of COVID with these existing conditions that is causing the greatest concern. And
because you aren't rich, you haven't had the non-communicable diseases of blood pressure, being overweight, diabetes, perhaps in the same proportion as the West. Would that be also a reason?
That will also be a reason. That and the fact that it's in this region of Africa, we are talking of populations where sometimes up to 70% of the population is below the age of 35. So people are pretty fit. I know a number of people who have contracted COVID-19, of Africans, most of them actually all the ones that I know personally right now, got it when they were in the US or in Europe, and just having conversations with them, it's an unpleasant illness, but the comparisons that they draw are to illnesses that are quite common here, like malaria and other illnesses, which in this part of the world we are quite accustomed to. So when people compare it, they'll say, well, it's not unpleasant, but malaria is far worse.
It's much worse.
Much worse. But however, this one is fatal. But again, so is malaria. The parasite can live in your liver for a long time. So again, we don't know what the interaction between COVID-19
and we're hearing, John, that with disrupted supply chains and the world turning inwards, that supply of malaria nets and malaria treatment a whole lot of that supply is putting people at risk, not of COVID-19, but of other diseases that you've already got.
That is a definite concern, and I think that we're concerned that we'll start seeing the mortality rate rising amongst the population who had pre-existing illnesses for which they were being treated, the cancers, the kidney failures, that whole raft of illnesses. But with our limited and fragmented health system, so it's partially private sector, partially public sector, and private sector is better, but more expensive. So there's a lot of lack of clarity and there's confusion in that respect. So it especially doesn't serve the poor. But health centers are, of course, now afraid, almost afraid of how to handle COVID-19 suspected patients. It's almost as if the entire health center can shut down because maybe not everyone has got the PPEs, and people just don't know how to handle this. And so we are beginning to hear of friends where people who don't have medication for some of their conditions, diabetes, high blood pressure, deaths from stroke. Just anecdotal evidence, mainly amongst the middle class, that those pre-existing conditions are beginning to hurt, partly because people can't go to hospital and get regular treatment. Yeah.
Let me ask you, John, certainly in poor countries without social security, a safety net like the West, the order to stay home and not go to market can be seen as an order to starve. How do you economically survive? How is it for Kenyans and Africans generally?
I think for large sections, especially of the continent's urban populations, a majority of our urban populations, some of the world's fastest growing cities, live in informal settlements. Very poor people who have to earn a living every day just to stay alive. So the concern has been that if COVID-19 gets a grip on any of these informal settlements, it'll just sweep right through, because people have to keep on working, people have to keep on trading, people have to keep on surviving. So physical distancing has been a lot more difficult in those parts of
they're so congested.
They're very congested, but people are taking seriously, wearing of masks, washing of hands, but it is still difficult. Fortunately, as of now, thank God, we haven't seen indications of a wave through the informal settlements. Some people say some of the measures, especially stopping the congregation, any congregation type event, whether it's going to church, going to a mosque. Some markets have been closed. Even funerals, you're limited to the number of people who can attend. Weddings,
How many people are allowed at a funeral?
I think it's 15. I'll need to check. But in Kenya,
it's 10 in Australia.
It's about 15 people at a funeral, which it's sort of, for Africans, it's a very.
It's not a funeral.
It's not a funeral, exactly. It's not a funeral. It's not a wedding. But I interviewed a young lady yesterday who's doing some very interesting thing with Islamic banking here, and people are getting married on Zoom. So, life goes on. Life goes on.
I guess it's still legal.
Yes.
Unlike in the West, in Africa, everyone goes to church or the mosque. People trust their religious leaders much more than they trust politicians. Have churches, imams actually been leading well, shutting down congregations, or have they been saying like some in America, oh, that isn't a position of faith. We should trust God and still meet.
A bit of both. We have some of, mainly, initially it was the evangelical, the Pentecostal churches. Some of them were very opposed to the physical distancing and to the stopping of congregations, and actually sort of lobbied for those measures not to be implemented as thoroughly as the government was suggesting. I think the Catholic Church was also initially quite reluctant, despite the fact that the Pope had already changed his MO really already. But they quickly had to come round, and so the church services are now aired on television, and people are very creative. People have a little cottage industry of making masks, and other equipment has come up. In Senegal, they've made ventilators. They've also developed a $1 COVID testing machine, COVID test. So there's a lot of innovation going on, and that's happening in the church as well. So now you can attend, you can go to church via Zoom.
Yeah.
And other Microsoft, I think, programs which allow basically literally hundreds of people to be on at the same time. And there's a way of you driving to pick up. If you want to take communion, you can drive, you can pick it up, and so people are quite
drive through communion.
Right. Well, you drive through, you pick it up, and so on Sunday you have it for you and your family, and you're able to attend mass, and it's all being done via Zoom. And one of the ironies is that
so McDonald's now has a rival from the church, drive through communion.
McDonald's has a serious rival from the church, and it's it's good. I think that our churches have been forced to innovate in this way, because it is not unlikely that some of the changes that have been forced upon us by this virus, which we don't have a cure to or vaccine, physical distancing in one form or the other will be there for quite some time. I'm not sure we'll be able to go into film theaters and sit next to each other for some time, etc., etc. So these innovations are quite critical, and people have moved quickly in that direction. But of course, this presumes that people have access to the internet on their mobile phone, so that they can be able to log on. Kenya's a bit better. We have good infrastructure for mobile telephony in Kenya, especially in the urban areas. Other countries, the response of different countries has been quite different, and some very effective. We talk about Senegal, Uganda, Rwanda, South Africa, where they've taken immediate action, and the leaders appear on television and reassure people regularly. And so I would say the religious fraternity generally got off to a slow start, and they suffered considerable. They suffered some credibility damage as a result of that, because some of the statements made it sound as if they were more afraid about losing their tithe than actually going out and serving people who are in distress and filled with anxiety about this mysterious new illness. However, they self-corrected quite quickly, and are now basically obeying all the rules and not contesting them. It's different in Tanzania, where the head of state, and I think one other country where the head of state has said, everything else stops, but people can still go to church. But this, I think, will probably end up not being the wisest thing, especially with this kind of novel virus.
And given that 60-70% of Africans are rural farmers. Are churches closed in rural areas also, or are they, because they're not big urban congregations, allowed to congregate?
Oh, it's a nationwide shutdown.
Right.
A nationwide shutdown. You keep in mind that our lessons here, partly because of the way globalization has moved over the last 15 years, increasingly countries like Kenya, which are Indian Ocean coastal countries, Kenya, Tanzania, Mozambique, all the way down to South Africa, the last 15 years has seen the renewal of very old relationships, like with China, with India, with the Far East. And so in as far as we're watching what's happening in the West in terms of mitigation measures and flattening the curve and all that, we're also watching and listening very closely to what's happening in Asia. What happened in China, what's happening in Singapore, South Korea, Taiwan. These are very interesting lessons from which we are learning, and I think the decision was made fairly early that, especially coming out of South Korea, where some of the earliest patients came out of Christian congregations, that sent home the message that okay, all large gatherings aren't going to happen. We're in the middle of Ramadan has just started here. Same is true for the Muslim community. All mosques are closed down, but you can tune in. You can still hear them.
Go online.
Yeah, you can go online. You can go online. So the most important thing for peace and stability is electricity and the internet.
Yes. Can I say, it sounds to me the picture of the government has been decisive. It's been clear. It's communicated. You've been a thorn in government's side in the past over issues of corruption. Are we seeing better governance? Is COVID-19 going to lead to some ongoing progress in greater transparency and better governance?
I mean, I think if COVID-19 hits sub-Saharan African countries with even a fraction of the force that we've seen it hit countries in Europe, the Italies, the Spains, the UKs, the US, where governance is concerned, it will really herald a moment of singularity, in that part of the reason our health system, our public health system, is non-functional is because of the corruption of the past. Because the money that has been allocated to build this infrastructure in this society has been systematically raided for the last 30 to 40 years. So it's not only a matter of development, poor development choices and priorities on the part of the leadership. It's also a major corruption issue in health and education, which are big ticket spending items for any developing country. You spend a huge amount of money educating and taking care of the health of your population, and so where the elite is predating on these resources, it undermines the system in the manner that we are seeing here. It's not as if it's not a problem. It is a problem, but I say it's a unique moment in that to solve this crisis and remain in power, our elite will have to do something. We'll have to make things work. We'll have to implement things with integrity, transparency, in a manner that people are confident and can trust them. That when their officials appear on television and say we're taking the following measures for the following reasons, that people believe them. And we've got to get there fairly quickly. Otherwise, COVID-19, given our demographics, is as much a health challenge, a governance challenge, as it is a health challenge.
Yeah.
In fact, in terms of the health side, we've we've almost overcompensated because we know of the weakness of the health side. So total shutdown, people are in their homes, physical distancing being enforced ruthlessly by the police, etc., etc. But this forces the question of how do we want to live as people? Well, what's important? We say we are a rich country. Wealth is being created. People are making money on the stock exchange, but we cannot cope with a virus like this one. And remember, this is a region where we have experience in dealing with this, because the HIV/AIDS pandemic swept through this Central and East Africa and hit us very hard. And we still have thousands of people who are on continuous treatment for this. So this is not new. And ultimately, there was a recognition that even though drugs were being developed, but in the early days, dealing with AIDS was a behavior change issue. That actually, I remember interviewing the Ugandan president, Yoweri Museveni. He hadn't, I don't think he had been in power for 10 years. And the story as it's told is that, Uganda had very good relations with Cuba, who had helped them train the rebels that took over in 1986. And so, the Ugandans sent a whole group of their top officers for training in Cuba. And if you remember at the time in the 80s, Cuba had at first
great doctors.
Great doctors and a very aggressive HIV/AIDS program, just quite controversial at one point because they were blocking off. So, they had a very robust public health system there. And so, the Cubans immediately tested all these officers and found, I think they found about 50% of them were HIV positive. And so at the next meeting where they met, Castro told Museveni, listen, you have a problem here. You send me your best guys. Half of them have this problem. So, what then happened was leading from the front, President Museveni came back and said, listen, we have a problem. We've got to be open about it. And it led to a very interesting phase in Uganda, where Uganda became very open about talking about HIV/AIDS, destigmatizing it, talking very openly about, that it is transmitted largely in our part of the world through heterosexual sexual contact, and dealing with that, discussion around condoms, discussion around staying faithful to one partner and stopping multiple. It's called zero grazing. So zero grazing.
Grazing. Yeah.
Zero grazing. Yeah, was zero grazing is when you have one cow in your backyard for your own milk.
It's called faithfulness and monogamy.
Exactly. But they use these kind of terms which sort of, but behavior changed, and Uganda's prevalence rate started going down because the entire nation bought into this and believed the leadership. Ironically, the prevalence rate only started rising in Uganda when the ARVs arrived, and NGOs got.
People thought they were immune, they were taking the medicine. Look, one last question, John. In terms of Africa, we often hear of the tribal identity, tribal tensions, how it can lead to violence in elections. Given the virus attacks all of us, we're all biologically connected through this virus, is there any transcending of tribalism? Is there any lessons that we're all in this together for Africa?
I think I would like to think so, because not only has COVID-19 hit the rich world first, within Kenya, within African countries, the people who are being avoided by everyone are the rich. Why? Because they're the ones who jump on planes and fly around the world. And so people who have servants in their home, the servants are afraid to come and work for them. Said, you're the people who are flying to America and all these, and Spain and Italy and all these places. So it's flipped.
The rich are the nippers for once.
Exactly. But I think I think it's a very humbling time uh, for everybody who sits and thinks and reflects, thinks coolly and quietly about this, because no matter how rich you are, no matter what wealth you have, uh, this is a viral terrorist, invisible one, that is completely indiscriminate, does not recognize rich or poor, no ethnicity, no race, nothing. So it's affecting everybody. So we haven't had any kind of mobilization along ethnic lines at this time, and because we're building up to elections in a couple of years, and that politics has been severely disrupted by this, with a population that's saying, hey, hold on, sort out this virus, which we're all afraid of, and fix the economy, which the measures that you've implemented to deal with the virus have interrupted. So this is an opportunity for new leadership that transcends these divisions that have been exploited.
Communal ethnic tensions.
Exactly, and can focus on what's important, and sometimes hasn't been treated importantly enough, of issues like just human safety and resilience of health, education, etc. The thing about the beauty of this kind of virus is that the fact, other pandemics and epidemics usually start amongst the poor, and it's the rich who are sort of huddled and trying to avoid it. This is different. This one is moving. They had to they closed our golf clubs about 1.5 weeks ago. The golf club is still open, and then they realized, oh goodness, some people are, no one's immune. People are dying there too, and I think that presents a tremendous opportunity for a redrawing of what growth and development and society means. That it's not all about just making money and getting rich. There are other tremendous benefits. First, I mentioned to you the incredible creativity we have seen out of just Africa's scientists with their own limitations, building ventilators, big industry building, making masks. But then also that we can now see our mountains from the capital city. We can see Mount Kenya and Mount Kilimanjaro.
The pollution has lifted.
Pollution has lifted. And so I'm one of those who thinks, hey, perhaps this working from home is something that we should take a bit more seriously. We should, we should keep it up and keep an office here for the boardroom, but does everybody have to pack in? And so, I was joking with a friend that said, man has been the planet's apex predator for quite some time now. Sort of indestructible, sort of bashing through everything. And for the first time in a very long time, this apex predator has been stopped. It has been
humbled. We are all vulnerable.
Yes.
Well, John, it has been an absolute delight, and I know Australians will be delighted to reflect with you. You're in our prayers, you and your wife, and as is Africa. And thank you for being with us.
And you are in our prayers as well. Thank you so much, Tim.